Hello, everyone, and welcome. And if you've tried to meet a health goal, you may have initially started all out, all motivated, energetic, but over time you found yourself going back to your old habits. And for example, maybe you're trying to lose weight, or you're just trying to eat better or exercise consistently. Well, stay tuned. This is for you. Today, we'll be discussing practical tips on how you can be consistent when adopting healthy habits. Welcome to Connecting the Dots with Dr. Ashaye. I'm your host, Lola Ashaye. I'm a family doctor and owner of In Touch Primary Care in Sugar Land, Texas. And I'm excited that you're here. This is the place to be if you desire to take charge of your health and do all you can to live a healthy lifestyle. Remember, you can listen to this episode and all our other episodes on the In Touch Primary Care YouTube channel. Leave comments, subscribe, and please share with someone that might need it. You never know, it could make a huge difference for them. So, when we're trying to meet a health goal, many of us know it can be difficult, right? It can be difficult to be consistent. It can be difficult to keep going. And all of us agree we need to prioritize our health. We need to pay attention to it. And the truth is, many of us actually know what to do for the most part, right? We know we need to get those vegetables in. We need to drink water, eat lots of fruits, get some rest. So we know in our minds what we should do, but doing it is a whole different story. And I completely understand. So why is this the case? Well, a major reason is our mindset. Okay, so our mindset is our thoughts and our beliefs about something. How we think about something and what we believe will ultimately determine what we do. So, for example, right, during COVID, during the pandemic, early on or even up till now, there are some people that thought COVID was not that big of a deal, right? They didn't believe that COVID had serious consequences, and so they behaved accordingly. They didn't wear masks, they went to crowded places, they just lived their lives as normal, right? Because of what they believed about COVID. And there were others who had a different belief system. They felt like, I don't want to get COVID. I don't know what the consequences are, or I know the consequences are serious and I just don't want to be around that. And so what did they do? They wore masks. Some of them got vaccines, some of them got multiple vaccines, right? Because they really didn't want to have anything to do with it. So that's the same thing with when we are thinking about health goals, basically. It depends on what we believe about that goal. If we're trying to meet a certain goal, the way we behave tends to follow. So another example is with healthy eating. So there are some people that feel like eating healthy is just boring. All healthy foods are bland. If I start eating healthy, I'm never going to enjoy eating again. And people, of course, we all want to enjoy what we eat, right? So if that is the mindset about healthy eating, well, guess what? Chances are you're not going to try to eat healthy because, it's too boring. Who wants to be boring, right? So that's the issue. We need to first address the mindset so that we can do what needs to be done. So for some of us, maybe that's not a big deal. Maybe we're healthy overall, or we think we're healthy. If you haven't checked, you have to check to make sure. And maybe changing your diet, or you're eating healthy overall already, so you don't feel the need to make any changes. But there are some people that absolutely need to make changes. It might even be a life or death situation, and they're having trouble making those changes, and they haven't addressed their mindset yet. So if you're one of those people who I really need to make a change, I really need to do something different. I'm trying, but it's not working. You need to listen to this. Number one, how do you change your mindset so that it aligns with what you want to do, but what you're not able to do yet? Well, the first step I will say is just be honest with yourself. Think about what you're thinking. Think about what your thoughts are. Are those thoughts negative thoughts, positive thoughts? You want to try to think about what you're thinking and think about where those thoughts came from. Some people believe, I've always been overweight. I'm always going to be overweight. Is that really true? So you want to really think about it, write those thoughts down. What am I thinking about? Because a lot of times these thoughts are actually things that keep coming up over and over and over again. Like you're telling yourself the same thing over and over and over again over time. And after a while, you start to believe it. And when you believe it, you start to act accordingly. So be honest with yourself. Take some time to examine your thoughts and figure out where they came from. The second step then is, once you've figured out, what you're actually thinking, then you want to try to find evidence to support or to dispute what you're thinking. So, for example, right, if you say you're one of those people that think, I've always been overweight, I'm always going to be overweight. You want to try to think about a couple of people, could be family members that are about the same size as you that have since lost weight, could be friends, could be, you may have to go out of your circle, but you want to find evidence that there are people that have been overweight that are no longer overweight, and use that as, that doesn't have to be the truth. That's not true. People that are overweight do not always have to remain overweight. So you want to find evidence to support this new belief on this thing that you know that is true, to support your new belief. Okay. So you do your best, search everywhere you can to find that evidence, and to tell yourself that whatever you believe, you want to make sure that it's actually true. Okay. So once you've determined the truth, anytime you think in the old way, you want to replace what you think that is with what you're thinking that's negative with the truth. You want to do that over and over and over again. And to do this, you actually would want to surround yourself with the true materials, okay, with the right information concerning your goal. So it's like you're learning a new language, or you're living in a different country where they're speaking a new language, where you're immersing yourself in this information as much as possible, so that you can start to believe differently. And when you start to believe differently about your health goal, you're much more likely to meet it. So basically, you learn as much as you can about your health goal. And it doesn't have to be difficult. I mean, you just want to be intentional. It could be as little as setting aside 10 to 15 minutes a day, listening to somebody that knows about your health goal that will inspire you to keep going. You just want to build it into your daily habits, doing something that will inspire you to reach your goal. You don't want to just ignore it, or it could reading a book about it every month, something intentional, something that you build into your daily schedule, and immerse yourself the best you can. Listen to it on your way from work, on your way back home, read something every evening, whatever it is, just be intentional as that working towards it. And I will say, there is so much information out there. And this is where a good primary care doctor comes in, because some of the information can be very misleading, especially when it comes to health. So you want to make sure you have a good primary care doctor or health professional, depending on the goal you have set for yourself, that you can make sure, you can confirm that the information that you have is the right information, because you don't want to spend a lot of energy doing something that is not going to work. So for example, right, if you're exercising to lose weight, for example, it's better that you focus on building muscle and on low impact exercise. So if you don't know that, and you're trying to lose weight and you're doing a sport like soccer or basketball, it might take a little bit longer, because that's not necessarily the best way to go about it. You want to, the better way to go about it is walking or swimming or a low impact exercise that you're doing consistently, and that will give you better results over time. So you want to make sure that you're plugged in with the right person, confirming the information that you're learning, and you're not just doing things and getting frustrated doing the wrong things. So you may have done all these things, And you can find that you can do it for a few weeks and then you fall back into your old habits, or, you do it for a few days and then, a few days later you find yourself not doing what you need to do anymore. Well, if that's the case for you, I have more information for you. We'll take this back up in 2 weeks. We'll talk more about what else you can do to cultivate a healthy mindset and reach your health goals. And if you're in the Houston area and you're looking for a doctor that's proactive about your health, check us out at In Touch Primary Care. We do things very differently at In Touch. Our practice is set up so that we can spend time with our patients so that they can reach us easily and they don't have to delay their care. And we can see you even if you don't have health insurance, or if you have a high deductible insurance, or if you're visiting from out of the country, you're an international visitor. You can find out more about us on our website, www.intouchprimarycare.com. So there's so many benefits of making healthy choices. I mean, apart from preventing serious health conditions, you hear me telling you, you feel better, your mood is better, you have more energy, more mental clarity, and you definitely save time and money seeing a doctor. So it's worth it trying to make health goals and trying to meet your health goals. So if you know anyone that may benefit from this episode, please share it with them. And that's all I have for today. Thank you for joining me here at Connecting the Dots with Dr. Ashaye. Until next week, see you then.